welcome to the LGBTQ Voice. I'm Tracy Welch alongside Eileen Dugas. Each week we invite guests on the show to talk about resources, events, topics, and what's happening in and around the South Coast LGBTQ plus community. Eileen?
Hi, everyone. Welcome to the LGBTQ Voice. My name's Eileen Dugas. This show is presented by the South Coast LGBTQ Plus Network. We're a nonprofit organization working with LGBTQ plus groups and allied organizations to build and maintain a comprehensive network for LGBTQ plus individuals and families in Southeastern Massachusetts. So welcome, everyone. We're glad you're here. And today we're going to talk about how is everyone doing? We need to check in, send us a message. We'll answer you live. So check in with us, ask questions. We're going to talk about what's happening in the community. And then we're going to talk to Paula Shiner, the Chief Executive Officer of Coastline Elderly Services. And we're going to check in with her on how her services have been impacted by COVID-19. Tracy, let's talk about what's going on in the community.
Cool beans. Thanks, Eileen. So I want to remind everybody about NB AGLE, New Bedford Alliance of Gay and Lesbian Youth. We usually meet on Thursday nights at our group center on Pleasant Street in New Bedford, and it's for LGBTQ youth ages 14 to 24, where we provide support, education, and leadership development. Since we can't meet each week, we actually have a Zoom call, a chat, to check in on all our youth or young adults. So if you're in that age group, 14 to 24, you have to join NB AGLE, A Perfect Place Facebook page to be part of the Zoom call. It's a private group. We want to keep our kids as safe as possible. So to be eligible to be on the call, if you want to call that, ages 14 to 24, and join the page. I want to make sure that you guys don't forget that on Friday nights, we have yoga, and you can join the South Coast LGBTQ Network plus Facebook page, and you'll check out the yoga. I think last week 137 people were involved in viewing and doing the workout, so that was amazing. For those who haven't heard, Carnival in Provincetown has been canceled. We were excited this year because we were actually going to be having a float in it. So cheers to next year. Hopefully next year, will be bigger and better. I'm very excited to be part of the events down in Provincetown. If you're looking for something to watch on TV tonight, check out the Happy Days of Gary Marshall on ABC. They'll be reviewing some of the old time Happy Days, Laverne and Shirley, just some of the movies that they've presented or he's done over the years. And that's something kind of fun to do. So when you get done watching us, you can kind of go watch the Boob Tube and kind of check that out. So today I also heard on Netflix that there's a movie about the women's 1999 World Cup soccer team. It's amazing because what happened in '99 was they made history. So you guys may remember Brandy Chastain, Christine Lilly, Mia Hamm, who married Nomar Garciaparra of the Red Sox. So just kind of keep that in mind. And maybe we'll be able to do a Zoom call on it like we did last night. Eileen and I were involved in the Zoom call from the movie A Secret Love, and we kind of reviewed it with people in our community. And that's one of the reasons that we invited our guest tonight, Paula, to talk about what's going on in the community and maybe talk a little about the movie as well later on in the show. Eileen?
Hi, so I would like to introduce Paula Shiner. Paula Shiner, like I said, is the Chief Executive Officer at Coastline Elderly Services. So welcome, Paula. Thank you for being here with us tonight. Can you tell us a little bit about Coastline and what Coastline does for our community?
Sure. Well, thank you both for inviting me to join you tonight, and thank everyone who's listening. Coastline is primarily an elder service organization, although we do also provide services to younger individuals, disabled individuals. Our mission is really to provide in-home services so that enables our seniors to remain in their homes and in the community for as long as possible. We've been doing this now for over 40 years. Some of our, I guess, more signature programs, I guess for lack of a better word, would be our Meals on Wheels program. Also our home care program, but we really do provide a wide range of services, Hard to describe them all, so what I oftentimes will say is if you are a senior or you know a senior, or if you are a caregiver, or if you are just looking for information about services that are available in Greater New Bedford, just call us. If we can't provide the service to you directly, then we'll find a way to help you and point you in the right direction.
Cool.
Excellent. So, Paula, I have a follow-up question. So if you don't know what services are available, do you have a number that people can call to find out? Is there someone who can walk them through that process?
Yes. So I'm going to give you the main number for Coastline. There is always someone available to answer the phone. It is 508-999-6400.
Thank you.
By calling that number, you will get to our intake department. And after speaking with one of the intake staff, they will get some sense as to what you might be looking for or how we might be able to help you. And they will refer you to the proper department. So for example, if it's a meal that you're looking for because you are not able to shop for yourself, you've just been discharged from the hospital, you just need some help around a meal, they'll forward you to our nutrition program.
Oh, sweet.
Don't know what your needs are and you just need to do some research, or you're a caregiver, you just want general information, they may refer you to an options counselor. And the word is it describes the duty perfectly, because that individual will reach out to you and will tell you what your options are, and then help you through the decision-making process. It's pretty simple, and the question could be about anything. So never hesitate to call. We are a resource for the community.
Thanks. So can you tell us what the protocol is for a health emergency such as COVID-19? And has Coastline ever had this type of situation happen?
So I personally have never had a situation happen like this. I am from New Bedford, been working here professionally all my life. I am a nurse by profession. That's full disclosure, because I'm always looking at health, wellness, and safety. And so very early on, I think when we were all just starting to hear a little bit about this virus, we almost immediately it implemented our emergency management plan. Even though the plan was not specific for a pandemic, it really provided us with some process that we could follow to ensure the safety and well-being, again, of our staff, our consumers, and our caregivers. So that was over 2 months ago, and here we are today.
Here we are.
And we still have very much the same concerns. And, so just in terms of how we are managing, most of our professional staff, our nurses and social workers, are managing their consumers and their care through telehealth, telephonic, virtual formats like the one that we're using this evening, phone calls. We're doing our best to keep in touch with our seniors, because many of them are socially isolated. They're home alone. They may or may not have family. If they do have family are not able to see them like they used to. Our frontline workers are still going in and providing the hands-on care that they need. I think many of our consumers right now are very fearful. They don't want to become ill. They don't want to have to go into a hospital setting. They don't want to have to go into a skilled nursing facility, right? lots of fear. So I'm very pleased to say that we are still able to provide the direct hands-on care and services that our consumers need to keep them healthy and safe. Most important, I guess, well, at least as important is our nutrition program. And the volume of service has grown. I think it's growing still on a daily basis. Again, fear, inability to go out and do grocery shopping, inability to access food, and so food insecurity is a major concern of ours. So we're doing approximately 1,500 meals a day, which is about 400 meals more than we were doing 2 months ago.
Wow.
So we're busy.
Yes.
But life is not the same.
Right.
And we don't.
Paula, you brought up an interesting point that, the people that you service are isolated, they're in their homes. Yes, they're getting, the in-home services if they allow people in. I'm sure there are some that say, I don't want anyone in my home. But you also mentioned how the in-home services are there, but even still, some of these individuals aren't able to see their family. Do you have any recommendations or ideas that have come through your program on how loved ones can stay in touch and support the people that you service that are feeling isolated?
Very good question, Eileen. And outside of the phone calls, because many of our seniors do not have access to the same tools that we do, that there significant limitations and no ability to really have visual contact. So we've been very fortunate that we have received some grant funding, and we are in the process. Again, we don't know how long we're going to be in this kind of scenario and whether we're going to see, second waves or another round in the fall. I think early on we were all very hopeful that this was going to be a short-term situation. Well, that isn't the case any longer. So we are purchasing iPads, and we're looking at how to provide some equipment as well as some access to internet for some of our most socially isolated elders. And either do a loan out, or we might outright purchase and provide the technology for them, and then teach them. And I'm not going to be the right person to teach them. You know how much trouble I had getting into this tonight. But we have staff who are going to be able to teach them how to use the tools so that they can communicate with family members. They can join some activities that we are now starting to look at providing virtually as opposed to the traditional way we provided them, which was.
Maybe Eileen can help you guys do the virtual bingo that she did last week.
There we go.
Right?
Oh, that would be so much fun.
That would be amazing.
So I would.
Go ahead, Eileen.
And that's a perfect example, because the worst possible thing for our seniors right now is for them to sit in front of the TV set and watch the news 24/7, right?
Yeah.
I mean, it's not healthy. So we need to think about mental health, well-being, and how to address issues around social isolation. So we sort of handled the basic necessities first, right? Security, access to the healthcare services that they need, and now we're looking beyond at how we can address some of the loneliness and the health risk associated with loneliness, and how we can also improve or address social isolation through activities.
Yeah. So Paula, if you're interested in bingo, let me know and I can help you work through that.
So I will be back touch with you, Eileen, for sure.
Paula, how often are you guys getting updated information from public health officials during this crisis?
So Tracy, that is a good question because my organization falls under the jurisdiction of the Executive Office of Elder Affairs from the state of Massachusetts, and they have done an amazing job at keeping in touch with us and providing us with the resources and the guidance that we need so that we are very informed. I've never had so many Zoom conference calls, go-to meetings, Ring Central, all of these things that I was unfamiliar with. But truly, they are concerned about our residents, our consumers, and they have been keeping us up to date with an ever-changing landscape, truly.
Oh, great. Eileen, you want to check into our live comment?
I sure do. So Alex is here. Hey, Alex. Let's see. Eric is here. Susan says Paula always helps. So
Thank you.
they're watching you, Paula. They're supporting you. Jackie Braga says hi, Paula, and Patty Nadeau says hi, Paula. So you have some.
All of my friends.
You have a fan club, Paula. So
Paula, go Paula.
yeah. Paula, I had a question about food. You had said that the meals program had increased by about 400 a day. What resources do you have to be able to financially support that? That's a huge increase. And a follow-up question is, how are you physically getting that done? Do you have enough drivers to do that delivery?
So many of our drivers are seniors themselves, and with health issues, and so early on they rightly so were afraid to continue to provide that service. So we did reach out to the city of New Bedford, to the Council on Aging in New Bedford, as well as all of the surrounding communities. We put a word out for volunteers, and I have to tell you, our community has come through big time.
Awesome.
We are so fortunate because we would not ever have been able to take this on and increase the volume as we have without the support of the community itself. So I feel so honored and so proud to be part of this community. We've been providing services to for a long time, but when we needed help from them, they were there for us. So we have a large number of volunteers who are doing meal deliveries with our staff. We have kitchens available to us in every one of the communities that we serve. It has been a true collaborative effort, a true partnership, and everyone has the same goals to make sure that our seniors have access to food.
Oh, that's terrific.
It's wonderful.
So speaking of food, can you tell us about the LGBTQ plus Senior Supper Club at Fairhaven Council on Aging? And maybe like when they may be resuming? Are they doing any virtual events? What's going on with that group?
So I do know that most of our councils on aging are members of the Massachusetts Council on Aging Association, and I know that they have been starting to look at how to resume services and activities. I think we're all waiting for guidance from the state's reopening committee on Monday, and some direction in terms of when and who are going to be able to reopen. But there are no plans that I'm aware of today for any of the councils to reopen, but many of them, similar to Coastline, are looking at ways to maintain some connection with their seniors and looking at virtual ways to do that. But to date, the seniors are the at-risk group still,
Yeah.
and to put them together in a social way is not in the cards for a little while, I'm afraid. Yeah.
Paula, I was wondering about, the reopening plan, and because you service such a high-risk population, will you have to make, I mean, I can't even imagine the adjustments you're going to have to make to services to even begin to deliver those in-person supports, never mind the virtual group, I mean, the in-person groups. So are you working on a plan for that? Is that something you're going to wait for the governor? I mean, how do you make, do you have any ideas? I mean, I think about this all the time. How do we make the seniors feel safe enough to resume those services, to have an options counselor come to their home and say, hey, we can help you, especially those that you don't have relationships with already?
So we are looking at that. And because we have a relationship with our seniors who are currently on service with us, they are more comfortable with their nurse or their worker. And so we've kept the lines of communication open. We are calling them. We're in touch with them frequently. I think that they are waiting for us to help them make those decisions.
I was going to add on to that. I mean, we could open up restaurants, all sorts of things for 2 months. If I was in that population, I would be waiting like 2 more months after that to make sure,
Right.
like, let me duck first, let you guys get hit and then see what's up for me.
And I think that that is probably what most of them are going to choose to do. And I think we will also encourage them to do that. The other piece to this that's really important is the personal protective equipment, the PPE that everyone is talking about. We are still, let's just say that not every employee and not every senior has access to PPE yet. We have just put in a large bulk order, and hopefully it will arrive and be timely enough so that we can provide all of our staff with the equipment that they need so that they can be safe going into home environments. But our seniors also need to have at least the mask so that they can be safe as well when someone comes into their home. We are getting closer thanks to many generous, donors. Joseph Aboud being one in the city of New
Yeah, I
Bedford
saw that.
just did an amazing job providing masks for healthcare workers, for essential staff, and also for seniors.
Yep.
So we've got a little ways to go before the door can truly be open and seniors be comfortable leaving their homes.
Yep.
Yeah.
So, Paula, some of us had watched the documentary Secret Love. The Secret Love is about two women who they've been together for 70 years, and they just had come out to their families. It was actually a 7-year process for the movie to be made, but with their age and needing assisted living arrangements, that was one of the factors of them coming out. Part of the documentary talks about their trip to an assisted living community. I know by being part of the Fairhaven Council on Aging, I go quarterly. Can you tell us some of the concerns that LGBTQ plus elderly face looking for or going into assisted living?
Well, Tracy, I have to say that I am glad that things are changing in that aspect, because when we first started the South Coast LGBTQ network, there was a lot of work to be done in terms of education for nursing homes, for assisted living facility, and quite honestly, for organizations, healthcare and social service organizations. I think we've come a long way, and pleased to say that there are facilities now who are more welcoming and more. I just think, better equipped because of the education that I think our network has been providing, the state has been providing, and some of the facilities themselves have more of an interest in providing. So I really do think, because we've been in this together for a long time and in it from the ground up, that we may still have some work to do. I'm sure we do, but at least we've seen some progress, and there are facilities that I think would be much more comfortable resource today than perhaps were 5 years ago.
Well, a few months ago, I was invited to the Fairhaven Council on Aging, and two of the guests were from assisted living in the area. And I don't know if people haven't been there, but there could be like 30 elders sitting. We have a nice dinner. We have a chat. And the group was asking questions, or talking about what they have and the amenities, or you can get this, or you can get that. And does anyone have any questions? So I'm waiting because I'm not in that age group yet. I'm getting there, but I'm not there yet. So I'm kind of waiting and no one says anything. And I said, well, is your staff trained, for LGBTQ, same-sex couple? It's, if one loses a partner, it's a little different. The bereavement that we've talked about for the network's a little different. For us to go to a straight bereavement group, people may not understand. And the woman was like, well, what do you mean? And I said, has anybody been trained? She's like, well, no. And that's when it opened up the floodgates. And everybody was like, well, why don't you? And do you understand? And what's going on? So the conversation wasn't, that some seniors, elders, don't have family to check up on them.
Yes.
So somebody could take advantage of them, could abuse them, could not give them their food, their medication, steal their money. And those are some of the conversations that we had that it's a little bit different when you're an elder, LGBTQ, and you don't have that family support.
That's
and
right.
Don't get me wrong, there's a lot of elders who aren't LGBTQ that don't have family support as well. But I just thought, with the movie that we were watching, the documentary, that it was kind of cool that, that you were on our show to kind of talk about the Fairhaven Council on Aging. And before the network and stuff, right, Paula? I know, Eileen, you just, joined the last few years. They didn't help. They didn't join. So now the Fairhaven Council on Aging, some of their elders actually are part of our Pride Committee for Pride Day. It's just an amazing turnaround of events that happen in our community.
Well, and we also have someone on our board.
Well, yes, Connie.
Yes.
Yep. Well, there's still work to be done, Tracy, in terms of education, and the state actually does have a curriculum now, and they finished it. It was Lisa Krinsky from the Fenway LGBT Aging Project that helped develop the curriculum for any healthcare worker. Finished it just before this pandemic. It was scheduled to be rolled out, and unfortunately, everybody's time and energy and resources have just gone in a different direction. So I fully expect that this training curriculum is going to put back on the table, and it will be a requirement for any healthcare worker in any healthcare setting. So I think that that is a huge step in the right direction. And even if it doesn't provide the depth of education that we might be interested in, it at least is the beginning, and it will start the conversation, right?
Absolutely.
And I'm going to give kudos to Ann Sylvia from the Fairhaven Council on Aging.
Shout out to Ann.
Absolutely, because when I asked everyone if someone would please consider LGBTQ supper club, Anne raised her hand without hesitation. And she's been hosting that supper club now for what, 8 years?
I was going to say 8 years. Well, and what's amazing too is Paula and Ann are straight allies. So, I mean, that when you think about it, right, a lot of people don't step up to the plate because of, oh, you're gay and I'm not going to help you, But to have straight allies, part of our network and part of the community, is just truly amazing.
Thank you. Our pleasure.
Yep. And the food has been really good. Psych.
So Paula, I want to, someone has a message here. Hi, Paula, how are you helping your mom?
My mother is very fortunate. She lives with my younger sister, and she's well cared for, and she's very happy there.
And Heather Mello says, Ann Sylvia is amazing at the Fairhaven COA. So she is being recognized here as well. And Paula, I want to thank you for being here. I want to thank you for your commitment to the network and Coastline. And I wanted to ask if there was anything that you wanted to add, anything you would like to say to the community about how they can support you or how they can get involved. Is there any support you need?
Well, first of all, I want to thank the community for the support that they are giving to us. Because again, without the help that we've been getting, we would not be able to provide the level of service that is needed. And secondly, I'd like to thank both of you for the work that you're doing in the network, in our community, as well as the members of the board. Ann Sylvia's gotten a lot of, a lot of kudos and accolades from us, well deserved. No, I really just want to be sure that if there is a senior or disabled person or a caregiver who has a question or has a need, that they don't hesitate to pick up the phone and call us, because we are available to help.
So just one thing, guys, I want to let you know that Paula recently stepped down as the network's treasurer. I want to thank you for your hard work that you've done for the LGBTQ plus community. I cry, guys. I'm a wimp. You're going to be missed for sure,
Thank you.
Yeah.
Well, you know where to find me.
Well, you ain't gone, honey. You're just retired from it. Yeah.
I'm still here. I'm still here and happy again to have been invited to participate this evening. And, I wish everyone well. Please, everyone, stay safe, be healthy.
Yeah.
So Tracy, we're almost out of time. Is there anything else that you want to talk about tonight?
Yeah, definitely. I'm excited to tell you that we've been working really hard on events for South Coast Pride, or Pride South Coast. We're kind of changing the name a little bit. But the details are going to be, some of the details will be revealed next week. We have a whole month of Pride events online and maybe some out in the community stuff that you guys will find out. An interview from the Stonewall veterans, David Velasco Bermudez, and his husband, Bob from Cape Cod. And next week, we're going to be talking to the Safe Schools programs of Massachusetts and the Child ID program from New York Life.
Mm-hmm. Thank you, Tracy. And I'm really excited about the work we've done to try to bring Pride into the community when we can't have a in-person Pride event. So I'm excited about talking about that next week.
Wicked.
Yes, it's going to be a lot of fun and a lot of creative things that we have never done before. So I'm really excited about that. And I just want to say again, Paula, thank you for being with us. Thank you for sharing and taking the time. I know you probably have a very busy schedule right now. So thank you. And thank you for everyone watching. And we will see you next Tuesday at 7. Have a great night.
Take care, guys.
Take care. Bye now.
Bye now.